works is think of it as three major buckets. We've got digital solutions for those of us who don't want to talk to anyone, who want to just engage in self-serve content, whether that's meditations, audio therapy, digital courses that help things like treat depression or help as a new parent, financial stress, all these different areas. And that's for everyone out there who's like, I'm not yet ready to talk to someone, so let me engage in this app on my own. The second bucket is around coaching. So we have a global network of behavioral health coaches who are all certified and are trained in helping things through behavioral motivation, behavioral activation. They help with things like stress at work, being a new manager. And then there's therapists who help with more clinical issues like depression, anxiety, and so forth. And so the whole model behind modern health is triaging people to the right level of care. So I think a good analogy of coaching is, let's say you hurt your knee. Do you go right to an orthopedic surgeon and get knee surgery? Or is it better to first go to a physical therapist and figure out what you can do, work with them to get your strength back and maybe prevent a really high cost surgery? That's exactly what coaching is. So coaching is our way for people to engage proactively with certified coaches out there who are trained in helping them with certain areas in their life. And so someone in the quote, yellow zone, if you will, would work with a coach. Now, if that person ends up being at high risk for depression or anxiety, a coach will triage them to a therapist. But therapists are trained in treating clinical diagnosis, like bipolar, OCD, anxiety, and so forth. If you're someone who's cooped up right now inside and that's really stressing you out, a coach is actually the best thing for you. They can help you work through that. They can help you figure out how to sleep, better sleep at night. And so it really depends on what the individual is going through. And behavioral coaching is a way to engage a much broader population, whereas clinicians, so therapists, are trained to treat those who are struggling with more severe mental health issues, which is about 15 to 20% of the workforce. The rest of the workforce can actually engage in coaching to help take a more preventative stance with their mental well-being.